Have you ever wondered why dentists use strange words like mesial, distal, or occlusal during your checkup? What if I told you that understanding these terms could help you better communicate with your dentist, understand your treatment plans, and even save money on unnecessary procedures? Today, we're diving deep into the fascinating world of dental anatomy terminology. By the end of this video, you'll be speaking the language of dentistry like a pro. And trust me, this knowledge is more powerful than you think. So, if you're ready to unlock the secrets hidden inside your mouth, let's get started. Today's video is going to be different. We're not just scratching the surface, we're going advanced with dental terminology in a way that's easy to understand and actually fun to learn. Whether you're a dental student, a curious patient, or someone who just loves learning new things, this video is for you. And hey, if you find this helpful, don't forget to hit that subscribe button and ring the notification bell so you never miss our educational content. All right, let's break down dental anatomy terminology step by step. Section 1. The basics, understanding tooth surfaces. First things first, every tooth has 5 surfaces and each has a specific name. Think of your tooth as a tiny building with different sides. Let me explain. 1. Occlusal surface. This is the chewing surface on your back teeth, your molars and premolars. It's the bumpy top part that grinds your food. Easy to remember. Occlusal comes from occlusion, which means how your teeth meet when you bite down. 2. Incisal edge. For your front teeth, incisors and canines, we don't call it occlusal. Instead, it's the incisal edge. This is the biting edge you use to cut into an apple or tear food. 3. Mesial surface. Here's where it gets interesting. Mesial means the surface closest to the midline of your face. Imagine a line running down the center of your nose. Mesial surfaces face toward that line. 4. Distal surface. The opposite of mesial. Distal means the surface facing away from the midline, toward the back of your mouth. 5. Facial surfaces, buccal and labial. The outer surfaces of your teeth have 2 names. Buccal refers to the surface facing your cheeks. Think buccal equals cheek side. Labial refers to the surface facing your lips. Think labial equals lip side. 6. Lingual and palatal. The inner surfaces facing your tongue. Lingual for lower teeth, tongue side. Palatal for upper teeth, palate or roof of mouth side. Now, here's a quick challenge for you. Pause the video and try to identify these surfaces on your own teeth using a mirror. Comment below how many you got right. Section 2. Directional terms, navigating the mouth. Once you understand tooth surfaces, we need to talk about directions. Dentists use these terms to precisely describe locations. Anterior versus posterior. Anterior means front, your incisors and canines. Posterior means back, your premolars and molars. Simple, right? But here's the advanced part. Apical versus coronal. Coronal means toward the crown, the visible part of your tooth above the gum line. Apical means toward the apex or root tip, the bottom of your tooth buried in bone. When a dentist says apical migration, they're talking about something moving toward the root tip, often not a good sign. Superior versus inferior. Superior means upper, maxillary teeth. Inferior means lower, mandibular teeth. Proximal, this is a smart shortcut. Proximal means either mesial or distal, basically the surfaces where teeth touch their neighbors. When dentists say proximal cavity, they mean decay between teeth. Here's why this matters. When you understand these terms, you can ask better questions. Instead of saying, "My tooth hurts on the side," you can say, "I have pain on the mesial surface of my lower right molar." Your dentist will be impressed. Drop a comment if you've ever used medical terminology with a doctor and saw their reaction change. Knowledge is power, folks. Section 3. Tooth anatomy beyond the surface. Now let's go deeper, literally. Your tooth isn't just one solid piece. It has layers, and each has a crucial role. Enamel, the hardest substance in your entire body. This outer layer protects your tooth from decay and damage. Fun fact, enamel can't regenerate once it's damaged, which is why prevention is so important. Dentin, the layer beneath enamel. It's yellowish and softer, with tiny tubules that connect to the nerve. When enamel wears away and dentin is exposed, that's when you feel sensitivity to hot and cold. Pulp, the living heart of your tooth. The pulp chamber contains nerves and blood vessels. This is what dentists remove during a root canal treatment. Cementum. This covers your tooth root and helps anchor it to the surrounding bone through the periodontal ligament. Alveolar bone, the jawbone that holds your tooth sockets. Healthy bone is essential for keeping your teeth stable. Periodontium. This is the complete support system. Gums, bone, cementum, and periodontal ligament working together to keep your teeth in place. Here's an advanced concept, the DEJ, dento-enamel junction. This is where enamel meets dentin. It's a critical boundary because cavities that cross the DEJ spread much faster in the softer dentin. That's why early detection is crucial. I want to hear from you. Have you ever had a cavity? Did your dentist explain where it was located? Share your experience in the comments. Let's learn from each other. Section 4. Dental formula and numbering systems. Ever heard your dentist say, number 19 needs a filling, and wondered what that means? Let's decode the numbering systems. Universal numbering system, most common in the US. Teeth are numbered 1 to 32, starting from upper right third molar, wisdom tooth is number 1, going across to upper left third molar, number 16, then lower left, number 17, to right, number 32. FDI system, international, uses 2 digits. First indicates quadrant, second indicates tooth position within that quadrant. Palmer notation uses symbols to divide the mouth into 4 quadrants. But here's what's really fascinating, the dental formula. Adults have 32 permanent teeth with this formula per quadrant. 2 incisors, 1 canine, 2 premolars, 3 molars. Children have 20 primary teeth with different formulas. Understanding this helps you track which teeth you have, which you've lost, and what restorations you have. It's your dental roadmap. Quick engagement question. Do you still have all 32 teeth, or are you missing some? Let me know in the comments. Section 5. Clinical terminology you should know. Let's finish with advanced clinical terms that empower you during dental visits. Caries versus cavity. Caries is the disease process, tooth decay. A cavity is the actual hole it creates, so technically you have caries before you have a cavity. Malocclusion, when your upper and lower teeth don't fit together properly. Types include class 1, 2, 3 malocclusions, crossbite, overbite, underbite, and open bite. Restoration versus prosthesis. A restoration fills a gap in a tooth, fillings, crowns. A prosthesis replaces missing teeth with bridges, dentures, and implants. Prophylaxis, the fancy term for professional teeth cleaning. When you schedule a prophy, you're getting your routine cleaning. Recession. Gum recession is when your gum tissue pulls away, exposing tooth roots. This can cause sensitivity and aesthetic concerns. Furcation, where tooth roots divide on multi-rooted teeth. Furcation involvement in gum disease is serious because it's harder to clean. Here's my challenge to you. Next time you visit your dentist, use at least 3 terms from this video. It shows you're engaged and informed. Trust me, dentists appreciate educated patients. What terminology has confused you most at the dentist? Tell me in the comments, and I might make a follow-up video addressing those specific terms. Conclusion. And there you have it. You've just learned advanced dental anatomy terminology in a way that's actually practical and useful. You're now equipped to understand your dental treatment plans better, ask informed questions during appointments, communicate more effectively with your dental team, and make better decisions about your oral health. Knowledge is your best tool for maintaining a healthy smile. When you understand what's happening in your mouth, you're more likely to follow through with treatment and prevention. Before you go, I have 3 quick requests. First, if you found this video helpful, smash that like button. It helps more people discover this content. Second, subscribe and hit the notification bell for more educational dental content. We're building a community of informed, empowered people who take charge of their health. Third, share this video with someone who might benefit, maybe a friend who's nervous about dental visits or a family member who wants to understand their treatment better. And don't forget, drop your questions, experiences, and which terminology confused you most in the comments below. I read every single one, and your feedback helps me create better content for you. Remember, your smile is worth understanding. Until next time, keep learning, keep smiling, and I'll see you in the next video.